That's the only way you can get. So here are the first things that you kind of need to know when we're talking here about Medicare. If you need to sign up for Medicare, there's a couple of different things that are important to note. Number one, if you have started taking your Social Security by the age of 65, there is no need to do anything. You will be automatically enrolled into Medicare Part A and Part B. They already have a place to be able to get your Part B premium from, which of course is your Social Security check, and you'll get your red, white, and blue card in the mail. However, if you have not started your Social Security by age 65, and you do want your Medicare to begin at age 65, the best way to get enrolled into Medicare in that situation is by going to the Social Security website. It is ssa.gov. And in the Social Security website, there will be a button for Medicare, and you'll want to click on the Apply for Medicare Only part. And that will allow you to go to your Social Security login and enroll in Medicare. Now, a lot of people say, wait, why do I go to Social Security's website if I'm signing up for Medicare? We have to remember that Social Security does all the billing for Medicare. So that is where you go to sign up if you want to get your Medicare to start at age 65. However, if you've started only your Part A at 65, and then you're going to stay on a group or some other kind of group insurance plan, employer plan, and you want your Part B to start at a later date, well, you cannot sign up online. You must fill out paperwork to sign up. You have to fill out your own paperwork saying that you want Part B to start. And then your employer has to fill out paperwork attesting to the fact that you have had company coverage, and it's credible coverage, ever since you turned 65, so that Medicare and Social Security do not charge you a late enrollment penalty. So when you go to get ready to sign up for Medicare, the most important thing to note is that you need to start the process 3 months before you want your Medicare to begin. All right. Now, there's also situations where it may make sense for you to disenroll from Medicare. Let's suppose that you signed up for Medicare at age 65, you had Part A and you had Part B, and then maybe a year or 2 or 3 or 4 down the road, something changes. Maybe you got a job with an employer that says, hey, I'm covering all of your cost as one of the benefits of working here. Well, if that's the case, there's really no reason to be paying for Medicare at the same time you have group coverage. And so you can actually disenroll from Medicare by filling out a special form, which I can always get to you, Form 1763, and you can disenroll. And then you've got other creditable coverage. You must make sure you have creditable coverage. And then maybe a couple years down the road, you decide to retire again, and you lose that group coverage, and you want to get back onto Medicare again. We just fill out that same paperwork as before. So some people think that, once you're on Medicare, you can never leave, because if you ever leave it, you can't ever get it back again. And that is actually not true. So just help somebody with this this summer. So let's talk about the different parts of Medicare. Part A is hospital insurance, all right? And when you have Part A alone, there's a deductible. Now, the way Medicare charges the deductible is it's per benefit period. $1,556 is the number. Now, they have not released the numbers for next year, but this number is really going to be pretty irrelevant for all of my clients, because we're not going to let you have just Part A for hospital coverage. The reason being is that if you're in the hospital and you only have Part A, and then you get out of the hospital for 60 days, and then you go back in again, well, you have that deductible that you have to pay again. So we would never let somebody be exposed to multiple deductibles in a year. So we always get something to go along with your original Medicare, all right? But that's Part A. Now let's talk about Part B, medical insurance. And with medical insurance, there's a standard premium. Part A has no premium as long as you or your spouse have worked 40 quarters and paid into the Social Security system for 40 quarters. Then Part A has no premium. Part B always has a premium. The base premium for this year is $170.10. And for those new to Medicare, for this year. Now, for next year, we don't know what the number is going to be. They don't usually release that number until sometime in November. Part B also has a deductible, and that deductible is $233 per year. And the biggest challenge with having just Part B for your medical insurance is the 20% co-insurance. And there's no cap on that. So you have to make sure you get something in addition to Part B also. Now, as I mentioned in the previous slide, there is $170.10 as the standard premium. But Medicare has come up with this thing called IRMA, which stands for the Income Related Monthly Adjustment Amount. Basically, what they're saying is that if you're going to be on Medicare, and part of your Medicare includes Part B, and your income is higher than these thresholds that you'll see here, if you file your taxes individually, or if you file as a couple, if you fall into any one of these ranges, instead of 170, if you were in the second tier, you'd pay $238.10. If you're in the third tier, you'd pay $340.20 instead of $170.10. And of course, this is per person. Now, the way that they assess, they check for this is they check the IRS database. So here's how it's going to work. On January 1 of 2023, coming up, they're going to want to know what your income was. Well, of course, you haven't yet filed your taxes for 2022. I mean, there's nobody who's going to have their taxes done on January 1 of 2023 for 2022. So they check the IRS database for 2021. They always go back 2 years. So for 2023, they're going to look at your numbers for 2021. And then they're going to assess that. Now, if you have one of 8 qualifying life events, and you say, hey, my income today is less than it was 2 years ago, don't charge me this higher number, charge me a lower one. We have a special form, and I can counsel with you on whether or not you qualify for that. It's called Form 44, and we can fill that out, and we can actually get your premiums reduced or the surcharges eliminated completely. So those are important things to remember about Part B. Now let's talk some more things about Part B. Here's a bad one. If you get a penalty, and that's because if you do not take Part B when you turn 65 or retire, again, if you're working somewhere at a job with an employer plan, and almost all employer plans are going to have creditable coverage. But if you decided not to do that, then you're going to face a 10% penalty per year for the rest of your life. So 3 years you went without coverage that was creditable, then your Part B premium, whatever the current amount is always going to have a 30% surcharge. And you need to remember that COBRA is not considered creditable coverage for Part B. So that's very important that as you think about when you're going to start your Medicare, that you understand how the different parts work. Now, there's another part that I call kind of bad with Part B, and that's if you get on it before you need to. Now, I mentioned earlier that some people who have started their Social Security by the age of 65 will get auto-enrolled into Medicare Part A and B. However, sometimes these people are still working and they've decided to keep their company insurance. Problem is, they are actually having double coverage. You're paying for coverage that's unnecessary. And the other problem is you lose your guaranteed issue enrollment period for Medicare supplements. So not only are you paying for two coverages, but you're losing some of your rights that are really important, and we don't want to do that. Now, I've also run into this as well for Part B. Third scenario, someone who says, well, I'm just going to fly solo. I'm not going to get a supplement. I'm not going to get an Advantage plan. And then they have something major happen, and they're responsible for 20% of all of their medical charges with no limit. So my strong suggestion to everyone is to have either a Medicare supplement or a Medicare Advantage to go along with Part B, especially because in our area here in Middle Tennessee, most of the Medicare Advantage plans have no premium. So it always makes sense to have something like that instead of just going all by itself. Now, let's look at Part C next, the third part of Medicare, known as Medicare Advantage plans. And they call them Advantage plans because they have more advantages than just being on original Medicare, Part A and B alone. And again, as I just mentioned, some plans have no monthly premiums, all right? How can they do that? Well, here's the way it works. When you get in, when you're officially on Medicare, they allot so much money from the general Medicare fund each month to pay for your care. Instead of them just allotting that money and holding it off to the side in reserves to pay for your care, they pay the insurance companies that money every month to take care of you. So even though the premium is going to be zero for you, Medicare is paying for your care monthly to the insurance company. Now, one thing that is very nice about Advantage plans, all right, they include Parts A, B, and D. Now, a common misconception with Medicare Advantage plans is that once you sign up for these, you lose your original Medicare, the Part A and B. That is actually not correct. You don't lose it. You must maintain Part A and B in order to add Part C, the Advantage plan. So you're not actually losing it, but you're not going to need to show your red, white, and blue card because the Advantage plan, you have one card to show at the doctor, you'll have one to show at the hospital, and that very exact same card is what you're going to show at whenever you go to a pharmacy, all right? These plans always have co-pays, which of course is a flat dollar amount, like maybe $20 or $30 to see a doctor. And they will also always have some portion of the care that is co-insurance, right? Which is a percentage. Medicare Advantage plans, every single one of them has a 20% co-insurance for durable medical equipment and chemotherapy. So, you know, those are just a couple of examples. Now, one of the nice things about these Advantage plans is that they do have maximum out-of-pocket limits. So that if you had a really bad year and you spent a lot of money throughout the year on your care, once you hit that maximum out-of-pocket limit, you do not have to pay for any more health coverage. Now, there is no limit for these plans when it comes to the drug coverage. They still are people still have to go through the coverage gap or donut hole. The catastrophic coverage portion of Part D, which we'll talk about here shortly, still applies, but the maximum out-of-pocket limits on Advantage plans only applies to the health side, not the prescription drug side. Now, one of the exciting things about the Advantage plans is that they can offer extra coverage like vision and hearing and dental and gym memberships, things that original Medicare Part A and B do not cover. And just remember, if Part A and Part B do not cover it and you get a supplement, the supplement cannot cover vision or hearing or dental because they only supplement after original Medicare pays. So there are some new stuff for this year. And some of the new benefits that some Medicare Advantage plans are going to be promoting, you will see this on your TV screen. Come October 1, just get ready. It's right around the corner. Joe Namath and JJ Walker and a whole bunch of those dudes are going to be out there promoting new things. And some of them are a healthy food card. It's like a debit card that they'll load money on that you can buy certain categories of healthy food, an over-the-counter allowance, like going to CVS or Walgreens and getting most things that you could buy there, like Band-Aids and vitamins and toothpaste and things along those lines. Many of us have heard about the Part B give back. In other words, if suppose you qualified for $100 a month Part B give back, instead of your Part B premium being $170.10, you'd only pay $70.10. Another Medicare add-on for some plans is a personal emergency response device that you can wear around your neck. And, you know, if you fall, you can push a button and an emergency person will, you know, contact you and come make sure to help. Some plans for 2023 will be offering acupuncture, chiropractic services, and even some utility bill assistance. Now, before you get too excited, just note that there are several limitations on being able to qualify for these plans. And a lot of these are only offered to low-income beneficiaries. And one other thing I do want to make sure to point out, there is no one single plan that would offer all of these. So that's why it's important to figure out what is most important, you know, and then go, okay, that's the plan I want. We have one plan for next year. Of course, none of this is officially released yet. We can't talk specific companies, but they have a dental benefit built in that has a $20,000 maximum. Now, I don't know all of the areas that that's in because, you know, for me, I sell plans in like 45 states. So they haven't even told me what state that plan is available in yet. It might not even be in Tennessee, but they're always coming out with new things to try to entice people to be able to join their particular plan. Now, you also need to remember that with these particular Medicare Advantage plans, you must obey the network rules, right? A couple of things to note. Doctors and hospitals must contract with the network, and you can only see doctors and hospitals and providers that are in that network. The doctors and hospitals can end their contract with the Medicare Advantage plan during the year. Now, as Dr. Wasade told you, I've been doing this for a very long time, started in 1997. I've seen more than one occasion where partway through the year, it might be August, and the doctor says, you know, my contract with this particular insurance company is up, and they negotiate, and the doctor says, you're not paying me enough, and they stop, and they say, you know, we're not taking any more patients, you know, from this plan. And if you happen to have that plan, and you want to go see your doctor before the end of the year, unfortunately, you have no coverage. Another thing that's important to note about these plans is that typically there's two main type of networks, right? There is an HMO and there's a PPO. Now, if you choose an HMO plan, you have to get your care from a doctor or provider that's in the network. If you go out, you have zero coverage. PPO plans are a little different. Most doctors are either in network or out of network. What does that mean for you? If you go to an in-network doctor or provider or hospital, you'll pay less. If you go to an out-of-network, someone who's not contracted, just know they are not required to provide you care. If they agree to, then they're going to accept the PPO out-of-network contract. You'll pay a little higher, but doctors are not required to be able to take you if they're not in the network. Also want to note, help you guys understand something. If you use your initial enrollment, like when you are turning 65 for a Medicare Advantage plan, you do lose your guaranteed enrollment for a Med Sup. However, there is something called a trial period I want to make sure everyone knows about. What that means is this. It's something known as a special election period. There's about 32 of these different election periods. And you might be asking, why do we have all these election periods? Well, when it comes to Medicare Advantage plans and prescription drug plans, once you enroll into one of them, you are locked into that plan for that calendar year. You are not allowed to change. But one of the things that Medicare does allow is this. In fact, I helped a gentleman, his name is Wes, with this recently. He called me up and said, hey, Don, you helped my brother and his wife get onto Medicare. When I turned 65, I enrolled into one of these Advantage plans. I've changed my mind. I want to go on a supplement plan. Well, we used something called the trial period. Even though he lost his guaranteed enrollment for a Med Sup, we still had a 12-month period that we could put him on the supplement with no health questions asked. Now, it doesn't work for every single Medicare supplement plan. You can't like choose just any of the plans you want. There's a restricted what plans you can go on. But even if you've made a change, and so I changed him, what's today, September 3rd? 2 days ago, his Medicare supplement took effect. We ended his Medicare Advantage plan. And generally, you cannot do that during the middle of the year unless you have a special election period. So there are a bunch of them that do allow people to make changes during the year, but most people cannot change until the annual enrollment period, which we'll talk about here in a second. Now, I also want you guys to know that a change that happened 2 years ago is that Medicare now allows Medicare beneficiaries with end-stage renal disease to join a Medicare plan. That was never the case before. So one thing to let you know about Advantage plans, there are now no health questions at all. So if come the annual enrollment period here next month, you say, well, I really don't like my plan. I'd like to possibly change to a different one, but I don't know if, my health isn't very good. Don't worry about it. There are no health questions on either Advantage plans or drug plans, which we're going to talk about here in a moment. Also, a new thing is that Medicare Advantage plans now have the flexibility to offer telehealth providers services in specialty areas. It used to be that you could only be a primary care doctor visit over telehealth, but Medicare has allowed these companies to expand to specialists, which of course is going to give more choices in rural areas, and people who don't maybe feel like going to the doctor's office or maybe an emergency room might want to get some, instead of not getting any help at all, they can use some telehealth services. Again, it varies by the plan that you're in. And with Medicare Advantage plans, the benefits and which plans are available are all based on the county you live in. That's the Advantage plans. Now, the prescription drug plans are based upon the region that you live in. And in a moment, when we get to the supplement plans, those plans are based upon the zip code you live in. So I'm sorry, it's a little bit confusing, but that was how our government chose to set it up. Now let's talk about prescription drug plans. This is very important. These are offered by companies contracted with Medicare. Now, once again, the government created Part D. It is a Medicare designed program. But unlike Part A and Part B, which you get from the government, just like Part C, Part D is the same way. You have to get it from a private insurance company. Now, if you were to get a drug plan, that's one plan that just covers drugs, they will have a premium with it. And every drug plan is going to have their own individual formulary, right? Meaning that that's the list of covered drugs that are on that formulary. So it's very important to make sure that your drugs are on the formulary. Now, here's one thing to know. It's very important to review your plan every year because formularies change from year to year. Just because you didn't change your medications does not mean that the company that covered it in 2022 is going to cover it in 2023. Now, here's an example. When I do a drug review for my clients, I always send them a report. And you can see here in this example that this client was on the WellCare Medicare RX Value Plus plan with a $68.90 a month premium. If you go down here, you can see the estimated total drug and premium cost for the entire year, if they stayed on this WellCare plan, is going to be over $4,000, whether they went to CVS or Walgreens or Publix. But if they switched to a different plan with a different formulary and a different premium, even though this plan here has a deductible where the other one didn't, well, this is only 25% of the cost. If they went to Walgreens, they'd only have to spend $930 all year for the total drugs, premiums, deductibles, everything. So that's a $3,000 a year savings. Now, because I'm a very particular, detailed person, when I do drug reviews for all of my clients every year, I have a spreadsheet and I say how much money I've saved them. And so for this year, I was able to save my clients $196,500 by switching from the drug plan they were currently on, which I put almost every one of my clients on the drug plan for 2021. But just because it was best for 2021 doesn't mean it's going to be best for 2022, which, you know, can save people a lot of money. So that is a service that I offer to all of my clients. There is no charge for it. I send out an email at the beginning of October. So if you're one of my clients and you don't see my email come by the first week in October, please reach out to me. It will be the standard email I send. It'll have a link in there, which will take you to a secure website where you can list your medications and other information. Hit submit, it comes to me. I'll go and run this report for you in the National Formulary Database. I will say, hey, the plan you're on is great for next year. No need to make any change. And it'll just automatically renew. Or I'll say, hey, here is this report that shows you how much you'll save by going from one plan to another plan. Let me know if you would like to change or if you would like to discuss this further. So just want to make sure that that's when you guys can be looking for that email. So how do you get prescription drug coverage? Well, one option is to get a standalone drug plan. Now, most people who get a standalone drug plan are going to have a Medicare supplement plan as their secondary coverage for their health part of their insurance. A second way to get prescription drug coverage is to get a Medicare Advantage plan that includes drug coverage. Now, it is important that if you choose a Medicare Advantage plan, you pick one that does have drug coverage attached to it, because not all of them do. And if for some reason you don't take Part D when you retire and you don't have any sort of creditable coverage, you can face in fact, you will face a 1% penalty per month for every month that you didn't have it. So if you say, well, hey, you know, I'm retiring and I don't take any meds, so I'm not going to buy a Medicare drug plan. And you just waited 3 years and you said, oh boy, now I'm starting to get old and sick and I need some kind of help insurance to cover my drugs. Well, then whatever time you decided to get on one of these plans, say it was 3 years later, you'd have a 36% penalty for the rest of your life. So it always makes sense, even if you're using a discount card, or like many of my clients get their medications from somewhere outside the United States. Okay, that's fine. But still a good idea to have a prescription drug plan. It's also important to note that there's a common mistake. We don't have time to talk about it on this presentation, that people make when they're trying to do this all by themselves, which leaves them with drug coverage and cancels their Medicare Advantage plan. So just know that you don't want to fall into that category of people, unfortunately, and lose your coverage. Now, let's talk about the donut hole. So first of all, these prescription drug plans have different stages to them, right? There's the deductible, there's the initial coverage stage, and then there's the donut hole. But just note that the majority of plans for 2023 are going to have a Part D are going to have an initial deductible. It's not going to change, right? But one thing to note is that many of these plans do exclude the deductible if you're using a tier 1 or tier 2 drug. That's an incentive for Medicare beneficiaries to use some lower cost medications, and then whatever the deductible is. I do have updated numbers for 2023. I'll show you here in a couple of slides, which will allow you to get around the deductible. Another thing that some of you already know about is that the Medicare is still allowing the senior savings model. And what this is a bill that was passed a couple of years ago. And $35 is still going to be the set copay for insulin. Now, each of these particular prescription drug plans are going to have their own list of which insulins they're going to cover for $35 a month. It's not that, oh, if I take any kind of insulin, all I have to worry is paying $35. No, it doesn't work that way. Once again, very important that you review your plan and make sure if you take insulin, you have a plan that covers it at the lower $35 a month price. Now, I already mentioned to you earlier about IRMA, the income related monthly adjustment amount. And I showed you this very same chart with the very same numbers here for individuals and couples when it came to Part B, as in boy. Well, guess what? IRMA also applies a surcharge to Part D. So if you are in this category right here, not the first, but say the second tier, whatever your prescription drug plan premium was for the month, you're going to have to tack on an additional $32.10. Once again, this is also for each person in the household as another surcharge. So what does that really mean? Well, unfortunately, if you have a very high income in retirement because you're still working, great, good for you. However, if you're retired and you have a very high income in retirement because of your investments that you're pulling from, that's a bit unfortunate because your advisor didn't put you in the type of investments that when you pull the money out, you have no taxes due. And so if you've got a lot of money in qualified funds like old 401k or IRA accounts, you do have to count that money as income. And what does that mean? That means that if you're at the highest level on that chart that I had on the previous page, that each month a husband and wife is going to be spending an extra $972 a month, or over $11,000 a year on their Medicare premiums. And people go, well, if I'm going to spend that much more, what do I get for it? Unfortunately, you get nothing for it. So if you are planning ahead for Medicare, very important that you know about this and take whatever steps make sense to help avoid this. Now, once again, you do have the right to request that Social Security lower your premium if, when you get into retirement, your income is lower than the 2-year look back that they're basing it on, but you must have one of the 8 qualifying life events. The second way to avoid it is what I just mentioned: proper Social Security and income planning. Talked with a lady named Teresa a few weeks ago, and I said, Teresa, do not take your Social Security yet. Based on your income from your shop that you own in Franklin, and your husband's income, if you start taking Social Security, that's going to bump you up into a higher IRMA. It does not make sense to do that. So, got to make sure you plan ahead for that. We do this type of planning for our clients. We do things such as Roth conversions. We also help people with Roth IRAs. We do life insurance and annuities to help people plan for retirement. Social Security maximization. Often question I get is, when should I start my Social Security? Can I get half of my spouses if they make more than me? Well, if you file it at the right time and all the correct conditions are, yes. If you don't, no. We do a specialized kind of investment called tactically managed money. That's another thing we do. Tax bracket management, making sure that we minimize taxes with every consideration that we do. And of course, some guaranteed income products that we use, annuities. And of course, we help people with extended health care. Some people call that long-term care coverage. So we do all of these type of things for our clients. They all work together. And it's important that you know how all of these things work, because most people that I talk with have never had their investment advisor or their accountant or any other previous insurance agent ever talk with them about IRMA or talk with them about these stealth taxes that they could be hit with during retirement. Just know your investments and your insurance are directly related. Your advisors need to make sure they are planning for these stealth taxes, which of course are optional. If you plan correctly, you do not have to pay them. So that is important. I always tell people, you get to choose. You can pay more taxes now. I understand that hurts. Or later, you pay an unknown tax rate on a larger amount of money along with a Medicare surcharge. So it does take some planning. Okay, let's talk about the last part of Medicare that many of you have and many of you heard about, and those are called Medicare supplement plans. Now, these are plans also from insurance companies that generally pay the 20% gap that original Medicare doesn't pay. That's why sometimes you will hear people call these plans Medigap plans. Just know that from a terminology standpoint, Medicare supplement and Medigap mean the same thing. Now, these plans have letters attached to them, like Plan G, for example. And each plan letter must offer the same benefits nationwide, meaning that if you got a Plan G in Tennessee, or you got a Plan G in Alabama, or you got a Plan G in New York, it doesn't matter. Every single Plan G has got the same benefits from every carrier. So if you're in Tennessee and I want to look at Blue Cross's Plan G, I want to look at Aetna's, I want to look at Humana's, I want to look, again, all the core benefits are exactly the same. Now, there is a monthly premium for Medicare supplement plans, and it generally increases each year. Also know that there is no drug coverage when it comes to Medicare supplement plans. So if you choose to go that route, you need to get a standalone prescription drug plan. So in this scenario, you would have Part A, you would have Part B, you would have a Medicare supplement plan, from just example purposes, we'll say Plan G, and then you'll also have a standalone prescription drug plan, which is known as Part D. So a couple more things to note about Medicare supplements. These plans are guaranteed renewable. No matter what your health is or how many claims you've had, you cannot be dropped. Another thing to note is you will never be singled out for rate increases. These plans base their rate increases on the group's claim, not your individual claims. So if they raise them for you, they're going to raise them for everybody else who's got the plan G. And a couple other things to note. Some of these plans were discontinued in 2020. Now, let me make sure to explain what I mean by discontinued. So the way it works in the insurance world, if the federal government ever steps in and says there needs to be a change made, all of those changes are for new people going forward. Of course, we've all heard the term grandfathered in. So for example, Plan F and C, right? Those were discontinued, meaning that anybody who got on Medicare after January 1st of 2020 is not eligible for Plan F and C. All new people moving forward. However, if you were eligible for Medicare prior to January 1st of 2020, and you've got Plan F or C, yes, you can keep it. Or maybe you've got a Plan F and the premium went up tremendously, and you're healthy enough to qualify for a Medicare supplement Plan F with a different carrier. Sure, we can move you. Once eligible, always eligible. That's how it works when it comes to Medicare rules and insurance, especially when there's a change being made. Now, the big key time that will affect everyone is the Medicare annual enrollment period, October 15th to December 7th. Now, the reason I say it affects everyone is this. If you're on a Medicare Advantage plan that includes drug coverage, we call them MAPDs, Medicare Advantage Prescription Drug Plans, this is your time to make a change. However, if you're on a Medicare supplement plan and a standalone prescription drug plan, this is the only time you can make a change to your prescription drug plan. So this particular time frame affects everyone. Any changes that are made between this time frame, this October 15th to December 7th, will take effect on January 1. So maybe you've got some very specific questions. You have unique situations. There's maybe some complexities. Maybe you don't want to talk about it online in front of everybody. No problem. You can contact us for some specific help, right? And here's one other thing. Very, 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 very common question I get is, well, I don't know if I want to get an agent involved. I don't have to pay extra for that. Here's what I tell people. The way I run my business, I'm licensed, I'm certified, I'm appointed with lots of, I can't even remember. I'm close to 100 different companies now that I have contracts with. There's no additional cost when you work with me, whether I'm doing Medicare planning or even financial advising. In other words, if you said, well, I'd like to get that Plan G and it's going to cost $110 and it's going to be with Aetna, and you call up Aetna, they're going to say $110. You come to me and I say, I put you on that plan with Aetna, it's $110. It's the same price either way for you. There's no extra charge. I charge my clients, insurance company pays me. So there's no extra fee on top of this. If you get an insurance product from me, the insurance company is going to take care of me. If you decide to get an investment product from me, the investment firm is going to pay me. So that's how I do my business. So if you have any questions, we can go ahead and open it up for questions now.
Yeah, let me just explain about asking questions. There are two ways to ask the questions. Some of you can ask through the chat line. You have to type the question, and then we'll open up for the audio section questions, and you can just unmute your mic and raise your hand, identify your name and ask the questions. I don't see any questions in the chat line. Anybody got an audio questions there? Can you unmute your mic?
Well, I just wanted to join because I am already retired and I'm already knows little bit of these, but still there are so complexity. I'm above 70 and I have an insurance and I am in Medicare Advantage plan. And my question is this, since I turned at 70, my expenses has been tripled. Like, I mean, so much expense, like taxes, you have to roll out the money, give the government so much, and then if there is a time limit, if I am late, then they will charge more money on the tax, and that is money-wise. The expense-wise, health, medical care, health was good when I was working. Because I'm aging, I have some issues, and that taking care of that is a very getting very cumbersome, because it is not very easy process for us. From my standpoint, they still have the donut hole. I don't understand these things. They still have the donut hole. Now I've been paying the drugs, medicines in one price, and now I have to pay more for some because I'm in the donut hole.
Yep.
Don, excuse me. Can you stop sharing your slides? We can get the whole screen. Can you stop sharing it?
Yeah, let me see how I do that.
I can do it for you.
You can do it? Okay, thank you, because I'm not quite sure.
Yeah.
The screen is not letting me stop share.
Oh, okay. I'm sorry.
Nope. Nope. Yeah, that's why it's important to review your plan every year and see what's going to be best, because things do change over time. I understand what you're saying.
And the problem I'm thinking of, if I move somewhere in another state, for say, then what happens? Do I still get the same benefit and everything?
Great question. So it depends. So if you have a Medicare supplement plan, that is an individual insurance plan, much like having a life insurance plan. And if you move to a different state, it travels with you. If you're on a prescription drug plan, or you are on a Medicare Advantage plan,
yes,
those are all based upon the county or the region you live in. And if you moved to a different area and that plan is not offered in that area, you will be required to get a different plan. I'll give you another example. There's some other special enrollment periods. My mother-in-law lived in California, and 2 years ago, we moved her here to Tennessee. She had undergone a major surgery and needed to have extra care. She's in an assisted living facility right now. She has been for about 2.5 years. She was on a Medicare Advantage plan out in California. I wanted her to have a Medicare supplement plan, right? Here, so there was no networks. She could budget for it. There's no copays for anything. And so even though she was sick, and even though she wouldn't traditionally health qualify for that supplement plan, the fact that when she moved here, that created a special election period. But the Kaiser Advantage plan that she was on out in California is not offered in Tennessee, meaning that she could have chosen any Advantage plan she wanted. But what a lot of people don't know, she could also choose a supplement plan. No health questions asked. So there's, again, lots of different scenarios. If ever you move, it's important to know all of what your options are.
So I know California is very expensive, but that's the only place where I might have to move in future. And so I'm thinking what's going to be the advantage plan I have. It is actually limited.
Yeah.
I
And so
think-
if you move to California
Yes.
and you look at an Advantage plan, we would have to know the county that you're going to be moving to in order to look at all the different plans that are available. Like I believe in Williamson County right now, there's 43 different Advantage plans to pick from. So we have to do the research and make sure that your medications are covered by that particular plan, that the hospitals that you want to visit or the doctors you want to see are in. So it takes a bit of work. And so, you know, but yes, I have lots of clients in California, understand how it works over there. Many people in California have the Advantage plans, and
Mhm.
if you move over there, you will have to change.
Okay.
I ask-
Okay.
Kunda has a question.
Okay, so just to make sure, the regular Medicare plan is available anywhere you move? Is that what you're saying? Or it has specific area restrictions also?
So Medicare supplement plans are based on the zip code you live in. They're offered in all over the entire United States. And the cost for those plans is based on the zip code, your gender, your age, whether you use tobacco or not. So that's how supplements work. Advantage plans vary by county. Now, I have an agent that works for me that lives in Iowa. And in certain counties in Iowa, there are only one insurance company that offers plans. That's it, just one. So they don't have 43 different Medicare Advantage options to choose from. So it just depends upon where you live.
I'm sorry, I'm not talking about Advantage plan. I'm talking about the regular Medicare plan. Is it valid in any state you go to, or are you restricted to where you live?
Medicare supplement plan, Medicare Part
A and B.
A and B, yes, that's in every state. Mhm.
Okay,
When Don says a supplemental plan is actually the traditional Medicare with supplemental policy.
Yep, and A and B is offered everywhere. That is a federal program, so it's the same in all states.
Which, I'm sorry, which one is better? Advantage plan where I am at or supplemental plan? Of course, the money is involved. I think supplemental plan requires little more money, right?
So, yeah, it just depends upon the person. Everyone's situation is different. Supplement plans, what people tell me they like about the supplement plans is that there's no network. They can go to any specialty hospital like MD Anderson or Mayo Clinic, or, you know, they're not in, those type of specialty places are not in network with Advantage plans. So what people tell me they like about the supplement plans are they like the fact that they can go to any doctor they want to that accepts Medicare. There's no referrals. There's no prior authorizations needed. And they can budget for it. Like, I know my premium is $150 a month. The end. I budget for it. I don't have to worry about whether I have, you know, 10 nights in a hospital. Now, on the other hand, they have a premium. So if you're incredibly healthy and you say, well, I just want an Advantage plan. I want to get the extra benefits like the dental and the vision, and I like the gym membership that comes with it, and I don't have to pay anything on a monthly basis, and that's great. Then that should be what's best for you. There's not one size that fits all.
Okay, thank you.
Just excuse me 1 second. There are some couple of questions in the chat. Don, can you see those questions?
Oh, I sure
The first
can.
question is, if you sign up for supplemental initially, can we switch to Advantage next year during the enrollment period?
During the enrollment period, yes, you can. So between October 15th and December 7th, you know, you might be saying, hey, I'm on a Medicare supplement and my situation's changed or my budget's changed and I just want to change. Yes, you can. No health questions asked.
And the second is a question is periodically several people ask me.
I can
if
see that
somebody
one. Yeah.
became a USA citizen, but never worked in this country, can he or she get any benefit from Medicare?
Yes. So here's how it works. In order to get a premium-free Part A as an apple hospital coverage, you or your spouse must have worked and contributed into the Social Security system for 40 quarters or 10 years. However, if that is not the case, then you can purchase Part A, and you have to pay a premium for Part A. It's about approximately $500 a month. If you're a US citizen, you can get Part A, and of course, then you would go ahead and get Part B, which is currently $170.10 a month. And then you could go either route, add on the supplement or add on the Medicare Advantage plan on top of those. So that's how it works if you're just recently became a citizen.
Of course, there's a third question on the chat line, Don.
Yeah.
Do you provide consulting to clients in Florida?
I do. I have quite a few clients in Florida. My last one named Barbara just moved there about three months ago. So I have quite a few clients in Florida. Florida is very unique. Florida has a completely different system for Medicare Advantage plans. It's its own unique animal. But yes, I do. I also am a part owner of another insurance agency that's located in the Tampa Bay area. So I go down to Florida several times a year to visit my secondary agency down there that does Medicare enrollments. So I'm pretty familiar with Florida. Here's a question. Does the sale of a home count for additional Part B premium given its only income for that year? Great question. So if you sold your primary home residence and you are a single individual, if you made a gain on that property of more than $250,000, then the amount that's counted above that, you're going to have to pay capital gains tax on. And that capital gains is going to be included on your modified adjusted gross income on your tax return. So the first $250,000 gain on your home is not counted towards your Medicare premiums. If you're a married couple, the exclusion amount on the gain on your primary residential home is $500,000. So if you made more than $500,000, then you would be subject to that capital gains being counted on your tax return, and that would affect your income related monthly adjustment amount for your Medicare. Now, I told you there's a form out there called Form 44 that we can fill out in certain circumstances that says, hey, today my income is not what it was 2 years ago. So I need you to, government, I need you to exclude this or wipe off these extra charges. Sale of a home is not one of those, unfortunately.
So Don, there's another question people ask me is several of our folks are traveling to India or other international places. And they say, what is the best supplemental plan which will cover international coverage? Yep.
So there's three plans that have international coverage, three Medicare supplement plans that are most popular that offer the international coverage. Plan F, which again is not available if you're new to Medicare after January 1 of 2020, but F covers international. So does Plan G, and so does Plan N. Now, the way the international coverage works is that if you needed emergency care, that's all it's limited to. There's a $250 deductible that you have to pay. There's a $50,000 lifetime maximum, and the insurance will pay 80% up to the $50,000. You're responsible for 20% of that.
Okay, the other question people ask is, with the new Biden's policies, the new bill that just passed recently, they're going to have some limits as far as the charging the expensive drugs and insulin and all. Do you know anything what's going to happen with the new
So in the past, Medicare has not been allowed to negotiate drug prices, which has been really silly. I mean, it's corruption. I don't normally say stuff like that, but it's been corruption. Where the drug companies have convinced our Congress people that, you can just, you have to pay whatever the full retail price is of these medications, period. Well, so one of the new bills that's coming across from, our current administration is that, yes, Medicare will be able to negotiate down drug prices in the future. It's not in effect for right now, but that's coming. The second part is the senior savings model, which I mentioned earlier for insulin. That's been around for 2 years now. That's going to continue. The pricing on the insulin, that's an insulin only savings program. And that flat rate is $35 from day one, $35 for your insulin. If you're in the donut hole, $35 all the way through every stage of the prescription drug coverage phases.
The other thing, as far as the Medicare Advantage plan, people usually have a little misunderstanding about the co-pays. Typically, the co-pays are fairly high. Is that correct, Don?
It depends. A lot of the Medicare Advantage plans, what they like to do is they offer zero premium, makes them very attractive. Zero copay to go see a primary care physician, very attractive. But then when you go to see a specialist, it might be $35 or it might be $50. You go to a hospital, the typical copay for a hospital stay is about, in Middle Tennessee, is about $350 a day for 5 or 6 or sometimes 7 days, right? So you've got these different, you might have to get an MRI. It might be $300. Outpatient surgery, $350. So they have co-pays and again, chemotherapy, right? That's a co-insurance. That's 20% on every single Medicare Advantage plan. So it can add up if you start having some health issues. Those co-pays and co-insurance can really start to add up. One more thing. I told you there was a maximum out of pocket for the Medicare Advantage plans. Medicare sets a cap on the amount that is the most that these plans can allow it to be. And for most plans, it's going to be somewhere between $5,000 and $7,000. That is your maximum out of pocket. So again, it depends upon the plan, but most of them are between $5,000 and $7,000. And once you've hit that for the calendar year, the medical portion of your expenses is going to be covered by the insurance company for the rest of the year.
Any other questions you have? By the way, this whole presentation has been taped on the cloud. So if any of your friends or family or you personally want to sit down and revise and review the presentation, just send me an email and it will be ready tomorrow. Also, all our presentations of the past year, every month, we have a different presentation. We place those on our website, icSSS.org. And in fact, I had given a lot of information and the contact information about Don on the flyers. But if you need to contact him, and if you don't have that flyer in hand, please contact me and I will forward Don's contact information. You may have a slide there, Don. Do you have a slide for your contact information?
Yes, but I would have to share my screen again.
Oh, that's fine.
Can I ask a question in between?
Yeah,
Sure.
go on.
Hello?
Yes.
Okay. I was reading something about a life insurance plan which has a rider for long-term care. Do you know anything about that?
What kind of plan was it that had a rider?
Life insurance.
Oh, yes. One of my favorite products is the life insurance plan that has a long-term care rider on it. So just note that whether you get a Medicare Advantage plan or whether you get a Medicare supplement plan, makes no difference. The maximum number of days that you would be covered in a skilled nursing home or skilled nursing facility is a maximum of 100 days. After that, you're responsible for the care on your own. You can do a traditional insurance product, like a health insurance product called a long-term care plan. But the more popular ones now are the life insurance plans that have a long-term care rider on it. So I'll give you an example. I've been doing this for so many years. I'll tell you that the number one thing I've seen decimate my clients' estates is to stay in a long-term care facility. So of course, many, many years ago, when I was in my 30s, I bought a long-term care policy, health insurance policy. It's a use it or lose it. I hope I die in my sleep and never need it. I paid my premiums, but you don't know. I recently got married here 3 years ago. In fact, this month will be 3 years. And my wife didn't have any kind of coverage. And so the newer things, the things that I prefer are the life insurance with the rider on the long-term care. Now we call this the new life insurance. So you see, old life insurance, the only way that anybody could benefit was, the person had to die and somebody else benefited, right? They got the death benefit. Well, with the new life insurance, we can use the death benefit that's on her policy to pay for her care for long-term care. And the benefit is that the insurance company is going to have to pay out 100% of the time. They're either going to A, pay out a death benefit because she died and never used it, or B, they're going to pay the death benefit early because she needed care. And so that's a much better investment. It costs a little bit more because there's a 100% chance they're going to pay out. But yes, there are riders, and they're a great thing to look into.
Can you add that to the whole life insurance?
No, nope.
Okay.
No, there are no companies that allow you to go back and add a rider onto an existing plan. For all companies, these riders are only available when you purchase a new one.
Can you name the insurance companies?
That offer these riders?
Yes.
Oh, yes. American General, North American, National Life Group, Lincoln Financial. There's a lot of them that have them.
So they do have to be whole life insurance, or
No,
are they term?
No, actually, a lot of them are indexed universal life plans.
Okay.
And there's a couple different riders you can get. Some of them you pay an extra fee for that rider up, on top of your premium. Some of them include the rider at no extra cost.
Okay, thank you.
Yep.
There's another question people ask me, Don. You are one of your partners. Do you give any presentations on the long-term insurance?
Oh, yes, I do that often. Again, it's incredibly important to plan ahead for that. There's a higher chance that you'll need care of some sort, home care, assisted living care, nursing home care. I mean, the numbers are pretty staggering. The longer you live, the greater the chance is. So I do have a presentation. I'm happy to come back on at some point in the future, if you'd ever like me to, about all the different solutions, long-term care, short-term care, asset-based, life insurance with long-term care, riders. There's a lot of options, and I'm more than happy to do that presentation if your folks there have an interest.
That's great. Any other questions? No, that was a great presentation, and give a good hand to Don. That was
Thank
great.
you so much.
Thank you.
And this has been recorded, and the recording comes out pretty well. So if you need to review the recording or send it to your friend or family, send me an email. My other thing is my website is www.icSSS.org. So you can log on that and you will see the recordings. Give it a couple of days for this particular recording to appear there. Again, thanks, and all of you have a nice holidays and enjoy the long weekend. Thanks.
Thank you, Dr. Wasade.
Thanks,
Great to
Ramon.
see you, Ram.
Thank you.
It's good to see
Okay,
you.
I'll end this.
Thank you.
Okay.
Thank you
Thank
very
you.
much. Thank you.
Bye-bye.
Bye-bye.
Thank you very much.
Bye.